Yeah, deep breathing or cold plunges or the other things that we talked about to help stimulate the vagal nerve aren't, they just need more help. So they still need to do these things with the supplements we're going to talk about. But if you're doing these certain things and you're still not seeing any improvements at all, it's worth trying these supplements we're going to talk about today.
And I really am coming to learn more and more about the importance of nutrients, right? Like you've talked in so many different episodes about the importance of nutrients in a healthy diet, and how that plays a role in so many systems of our bodies. And I think sometimes we don't think about how what we're eating can actually affect our nerves. And obviously, all of the nutrients you're going to talk about it at some point we could get from some sort of plant, or animal at some point if we ate it. But we take a lot of supplements now to give us extra or to make up for anything that's been lost in our diet because of how we cultivate or anything like that. And so eager to hear about it. Let's start with the very first one. What is the first supplement that you recommend for anybody who wants to start taking better care of their vagal nerve and help tone it so they can respond to life appropriately?
So the first supplement I wanted to talk about, and you definitely do get this one from food, but most of us don't eat enough of this food, and it is fish oil. Especially you want to get a good amount of DHA. This is the most neurological part of fish oil. We have two different fatty acids in there, EPA and DHA, and we want to get a good amount of DHA in there to help support a vagal nerve tone. And also this helps with heart rate variability. Obviously, if you're just helping your vagal nerve, you're going to help with your heart rate variability, but I wanted to put that out there too. So how omega-3s work is our nervous system is made up of cells, and they all have membranes around them. So our membranes could become inflamed and toxic and not work how they're supposed to, and that affects how the nerve signals go down the vagal nerve. Yeah, so when you take the omega-3 fatty acids and you have healthy membranes, it's going to help the signal go down the vagal nerve and send it to the appropriate areas like our heart, our digestive tract, so it would have our heart pump appropriately, send the oxygen throughout our body appropriately, help us rest and digest, absorb our nutrients appropriately when our vagal nerve is working how it should.
So I remember when I was in school learning about the myelin sheath and how it kind of mirrors when we're looking at electricity, for example, and if we're we've got wires connecting from one thing and we want the signal of the electricity to go down, like what helps it? Well, it's that protective covering that we put over the wires that actually helps the signal. Is that what you're referring to? Is like omega-3s, because it's fatty acid, that's what builds some of the aspects of our nerves, such as the myelin sheath, with helps the communication to work faster and more effectively.
So definitely a piece of that is the myelin sheath, so we're able to send the signal more appropriately. Probably what you guys have maybe learned about is the more myelin sheath we have, the faster signal it's going to be, and the less you have of it, it's going to go slower and be more sluggish. So yes, omega-3 fatty acids do help heal the myelin sheath, but also helps heal the internal cell structure. And the myelin sheath is made up of all these little cells that have the phospholipid bilayer. But yes, the myelin sheath is part of that.
All right. Well, yay, I got an A in biology then here. So my next question then is on the second supplement. I've been talking with you a lot. I mean, we go through some, lot of conversations on this podcast that has taught me so much. But for some people, it might be a bit surprising to hear the next supplement on your list. So definitely eager for you to be able to explain how this works. And you have probiotics on here. So how are probiotics going to help our vagal nerve?
So how is a probiotic actually going to help our vagal nerve, right? So the big thing is that our vagal nerve is one of the few nerves that we have in our body that connects our brain to our gut. So if we have a good, healthy GI tract and we have a good, healthy microbiome, this is going to then improve our vagal nerve tone, because it's going to help heal that communication between our brain and our gut. So if we have an unhealthy gut, we are going to damage our vagal nerve. If we have a healthy gut, our vagal nerve is going to work better. So it's kind of a catch-22, right? Because if you have vagal nerve issues, it leads to gut issues. But gut issues can lead to vagal nerve issues. So it could just be a vicious cycle that goes along there. But the big piece there is with probiotics is we want to make sure we have a good, healthy gut, and that will help us have a much healthier vagal nerve.
Now, I have heard In some of my groups that I've been in, I've been involved in some biohacking and so forth with other people. I remember reading somewhere that there's evidence that the microbiome can actually travel up and down the vagal nerve. Is that true? And would that explain, if so, the gut brain connection, right? Like how that all works together.
That's an interesting concept, and I don't know if it, absolutely that is true or not. But the idea that bugs are actually going outside the gut and getting into our nervous system sounds a little far fetched right now, because that could definitely possibly lead to sepsis and all kinds of possible issues. I mean, I think it's more of the anti-inflammatory effects in the gut are then traveling up and decreasing inflammation throughout the entire nerve, and then that's affecting our brain. And a big piece of the gut brain connection too is the neurotransmitters that are transmitted. So our gut makes just as many transmitters as our brain, and those neurotransmitters can go into the bloodstream, travel up to our brain, and cause good or bad things to the brain. It could cause dysregulation when the gut's not working right and you're making too much of serotonin or dopamine or norepinephrine, etc., and cause a disturbance of how the brain is working appropriately and lead to mood disorders or Parkinson's disease or Alzheimer's disease, etc., that could possibly be related to that. But the understanding I had, what you're talking about, the microbiome travels up the nerve, I don't know about any science behind that right now.
Okay. Well, that's interesting. So, okay, we have one as omega 3s, and that's affecting that communication between the brain and the rest of our body and the whole nerve signaling. We've got probiotics, which are helping a healthy gut. Healthy gut leads to a healthy vagus nerve. It also affects the brain, which also affects the vagus nerve. So we see how this like cyclic, vicious cycle can happen if you're dysregulated. Next on the list, what's the third supplement that you recommend for anybody who wants to tone their vagal nerve?
Now, the third one I wanted to talk about is ashwagandha. So, what we really want to help tonify our vagal nerve is we want to calm ourselves down. Like a lot of the things we talked about last time, it's just to calm our nervous system down, like meditation, right? Get enough sleep. It chills us out. Get enough deep sleep. All these things help improve our vagal nerve tone because it helps calms us down. And ashwagandha is great on modulating our cortisol response, which is our fight or flight or our stress hormone that we make. So it's a great modulator. When I say modulator, that means it increases it when it's needed and decreases it when you don't need as much of it. And herbs can work great like that, like ashwagandha, to actually have that modulating effect, because you just don't want something to totally block it or totally increase it, except if you're specifically testing it and treating it appropriately. So something that you can really start with to help heal the adrenal glands or help our circadian rhythm and help our cortisol responses is to take ashwagandha and help calm us down and help tonify our vagal nerve.
And I can definitely speak to anybody who's listening. If you have not tried ashwagandha, I definitely have noticed when I do take it, and I don't take it often, but I'll take it, during different seasons of my life. I definitely notice an effect. And I would say I notice an effect within about 20 minutes of taking ashwagandha, that I just feel a little bit more just present, a little less anxious, and a little more focused, actually, too. Just like I'm here and I'm not escaping into my spaceship somewhere so that I can escape the anxious situation. So it definitely makes a difference for anybody who's curious about it. All right, number 4 on our list for supplements that will help us tone our vagal nerve, Dr. Jake.
Yeah, number 4, one of my favorite ones to really calm us down is magnesium glycinate or threonate. These two forms actually cross the blood-brain barrier. The magnesium can have difficulty crossing the blood-brain barrier, but when it's attached to these certain amino acids, is able to pass through there and act on the GABA receptors in our brain. So yeah, magnesium acts on the GABA receptors in our brain, and the GABA receptors is what our brain uses to chill us out. So when we're running away from our bear, we stimulate the cortisol and epinephrine, etc. And then when we actually calm down and the bear isn't there anymore, we act on the GABA receptors. So magnesium can help act on those GABA receptors and calm us down. And through this calming effect, we're able to tonify and heal our vagal nerve.
Would you say then that from what I'm hearing you saying is that by tonifying the vagal nerve, it's actually like there's a two-way approach. There's like body to mind. So heal the body, heal the vagal nerve, influences the brain and how the brain responds. But also top down, affect our thinking and our anxious thoughts. That too actually influences our vagal nerve, which then affects the body. Like there's a top down and a bottom up type of approach to healing the vagal nerve.
Yeah, definitely.
Okay, wonderful. So next question that I have on the list then, moving forward, we've got omega-3s, we've got probiotics, we've got ashwagandha, you've got magnesium L-theanine or glycinate, and next on the list for the vagal nerve, best supplements.
Yeah, the next supplement I want to talk about goes along a lot of the lines of ashwagandha and magnesium is calming us down, but I wanted to talk about this one because this one works so well, is L-theanine. And this one calms us, but it also helps in the research that we've seen, it helps increase alpha wave production in our brain. Alpha waves is the calming relaxation wave that we have in our brain. So, and when we're relaxed, we actually make that alpha wave. So L-theanine is one great way we can actually calm ourselves down too and help improve our vagal tone. Yeah, so the next supplement I wanted to talk about is Acetyl-L-carnitine. And this works differently than anything else we've just talked about regarding like calming us down. Is Acetyl-L-carnitine actually works on stimulating healing of the mitochondria in our nervous system. We have a lot of mitochondria in each cell of throughout our nervous system. So if we are able to heal the mitochondria, we're able to heal anything in our nervous system, including our vagal nerve. So this is one that I really loved. If you have some trauma and damage that has occurred to your vagal nerve, it's not working appropriately, this helps. Acetyl-L-carnitine actually helps heal it and regenerates that nerve and makes it work how it should again.
Well, so that really seems like with the acetyl-L-carnitine at like root cause, like cellular level, for healing. And I love that you have like really a mixture of different approaches here, Dr. Jake. You're talking about, body to mind type of approaches, mind to body type of approaches, cellular approaches, and so forth. You're really hitting this from all angles. You have one last supplement on this list, and I'm eager to hear what the reasoning is behind this one.
Yeah, the next supplement I wanted to talk about is B complex. So B complex is a combination of several different B vitamins, B1, 6, 12, and 9, and it has others, 2, 3, etc. But the most important ones I want to talk about for vagal nerve tone are 1, 9, which is folic acid, and then I want to talk about B6 and B12. All these work on helping our methylation cycles. So methylation is how our body actually does what it needs to do. The cellular mechanisms throughout our body all depend upon methylation. So we're not able to send a signal down our vagal nerve very well without appropriate methylation. So these B vitamins, as long as they're actually methylated, help us do that. Because there's a lot of people, probably 50% of us have what's called MTHFR gene mutation, which we don't methylate very well. So I always recommend getting a methylated B complex so it works appropriately. Also, what's great about these B vitamins is it's actually good on healing the mitochondria also, like acetyl-L-carnitine. So we need B6 and B1 to help have the mitochondria work how it should. Also, what's great about it is it helps it balance out our neurotransmitters. So our neurotransmitters in appropriate balance, then we're able to actually send appropriate signals down our vagal nerve. So that's why sometimes when you're really anxious, you could have some tummy troubles because it's sending a dysregulated response down your vagal nerve. So if we're able to balance that out, we're able to improve the vagal tone so it doesn't cause those tummy troubles that could be caused by just anxiety or depression.
Interesting. Well, Dr. Jake, you've given us just a wonderful list here for us to take a look at. For those people who are thinking, they've done their research, they've gone down the rabbit hole, they've decided vagal nerve is my issue, I need to solve it, and they're listening to this episode right now. Any recommendations on, based on like side effects? If somebody were to just go down this list and like buy all of these from your website right now, I know you have a supplement line, like would there be any dangers of combinations or dosages or, anything that you would want to have them make note of before going through this whole list and starting to take any of them?
Yeah, so just like with anything, supplements are maybe more gentle than drugs, but you could definitely take too much of a certain supplement. So, like magnesium glycinate threonate, my favorite supplement is like Brain Mag. You don't want to get more than like 600 to 1,000 milligrams per day. It's not necessarily going to be way harmful. You're just going to probably just get diarrhea, or you could feel slightly sedated. Acetyl-L-carnitine, you could get a little bit of numbness and tingling if you take too much. You should only be taking about 600 to 1,000 milligrams per day of acetyl-L-carnitine. B complex, I wouldn't take more than 5,000 micrograms of B12, or more than 200 milligrams of B6, or more than 100 milligrams of B1. But really, you just got to go to, you shouldn't just take things willy-nilly. Honestly, you should go to a doctor that really knows what they're talking about, so they're actually able to prescribe it appropriately for you and what's going on with you, and to give you the exact dosing that's really needed for your issue. I wouldn't say take all these supplements for your vagal nerve. It's picking and choosing what works best for you, and your doctor can really help you with that.
Well, thank you so much, Dr. Jake, for your expertise today. And for our listeners, if you want to just try a couple, like I said, like kind of think about what Dr. Jake said about some of the amounts and so forth, but trying a couple, seeing how that works for you, trying a few others later on, you can actually get any of the items on this list from Dr. Jake's supplement line at shop.integrativemedica.com. Use that coupon code Dr. Jake to get 15% off. And then, of course, seeing Dr. Jake to be able to go over a plan for you, because most likely if you've got vagal nerve issues, there's other issues that are happening as well. And so he can actually help you with putting together a whole plan for your body's needs and so forth, give you the right labs that you might need to make sure that you're on the right track and so forth. And you can do that by scheduling an appointment with Dr. Jake, drjakewellness.com/schedule. Or you can call them at 801-938-7965. Dr. Jake?
Yes, if you want to learn more about vagal nerve and you're watching YouTube, click my videos to the right. I'm Dr. Jake, and I'll see you there.